know that the under eye area is the first to show our age, and there's so many different things you can do to rejuvenate the under eye area, whether it's under eye bags, under eye dark circles, under eye hollows, under eye fine lines and wrinkles, or just a sallow, sunken, tired look under the eyes. There's so many different things we can do to rejuvenate this area, and it's one of the most common areas that I treat in my office when seeing patients every day in my clinic. Hi my beauties, we just finished doing an Ellacor for loose elbow skin, which is not the topic of today's video, but I wanted to pop in here while I can and start this new video that I'm going to be doing, because in the previous case where I was treating this beautiful woman for loose elbow skin with Ellacor, which is a microcoring device that tightens skin, she was asking me to do a under eye video, and actually somebody earlier today asked me to do an under eye video as well. And I've done several of these in the past, but I think that they're very useful because there's so many different things that can be done for under eye tightening, smoothing, and rejuvenation with under eye bags, under eye hollows, dark circles, fine lines, wrinkles, all the things. And because two people mentioned that to me today, it prompted me to say, well, let's just get the ball rolling and start a vlog style video for under eye rejuvenation. There are so many under eye treatments that are available, but the problem is that it can be overwhelming for the consumer or the patient to look online and try to find the best treatments that are right for them. The other problem is a lot of providers aren't skilled and trained in treating the under eye area. So instead of simply saying, I don't have the laser to do that, or I'm not trained to put in eye shields, or I've never had any training experience in how to perform procedures on the under eye, they'll just tell people, oh, well, we can't treat that area, or, oh no, you can't laser that area. And I find that a lot from patients who come in to fly and see me from all over parts of the world because they've been told by providers that they simply are not a candidate for an under eye treatment, whether it be a laser, an energy-based device, an injectable, and so forth. So after watching this video, hopefully you'll understand the changes that can occur under the eye and different treatments that can help treat them and erase those changes. And sometimes they're done individually, or sometimes they're done in combination for each individual patient for a customized approach to make your under eye area look its best at every age. So the reason why the under eye is the first area on our face to show our age is because the epidermis and the dermis are very thin in that area. Also, with the underlying fat pads that can kind of become atrophic or thinned out over time, it is a telltale sign of aging. Even when you smile, even in your 20s, you can start to have fine lines and wrinkles under the eyes. So we start to age as soon as, we're done with adolescence, which is a sad truth, but it's just part of life and living, and there's things that we can do to combat those changes. So some of my patients are even in their 20s, and they're in their 30s, 40s, 50s, 60s, 70s, 80s, and beyond. And I know for myself, because I had early access to lasers and different rejuvenating treatments at a young age as a medical student and a derm resident, I would perform these procedures on myself. So I've been doing Fraxel at least once a year under my eyes since my early 20s. So now in my 40s, I'm seeing the benefit of all those pre-juvenation treatments that I did under my eyes. I did Fraxel, and I also did Thermage, which is a collagen banking treatment. Now, collagen banking just means increasing your collagen stores, because when the collagen stores get depleted as we get older, then the fine lines, wrinkles, and crepey skin starts to set in, because collagen is an extracellular matrix protein that gives structure to the skin. It makes skin smooth, tight, and plump. And as we get older, we stop making as much collagen as we used to, and we're getting more of our existing collagen broken down. So that is why in a thin, delicate area like the under eye area of the epidermis and the dermis are very thin, that loss of collagen is the first to show the signs of aging and takes the biggest hit. So by doing prejuvenation or rejuvenation treatments by increasing collagen stores, you can kind of offset that, and that's the true meaning of anti-aging. If you're going to lose 1% of collagen each year or 10% of collagen each decade, then revving up your reserves and increasing your collagen stores in your skin is going to kind of offset or keep you ahead of the curve, and that is the true meaning of anti-aging. So a lot of people ask me personally what I've done in the past, and in addition to doing Fraxel about once a year just for my under eye area, I started doing Thermage at age 30, and I do it every 5 years. I did it at age 30, 35, 40, and 45, and I'll probably do it again when I turn 50. And it just keeps those collagen stores up, so when you have more collagen, your skin is tighter, firmer, and smoother without filler, without any injectables, or without fat transfer or surgery, which is a really nice way to maintain that skin envelope soap to help keep the under eyes rejuvenated by just increasing your skin's natural ability to have collagen, which gives it a smooth, tight appearance. Now, I've had patients who have come in to see me from different parts of the country and different parts of the world, and they were told, well, my provider has Thermage, but they just don't do Thermage under the eyes. Or even worse, they'll use the Thermage handpiece that's engineered for the face and treat the under eye area thinking that they're targeting that area. This is the deal with Thermage and under eye. You need a special Thermage tip, which is a very small square surface area, to treat the under eye area, which is different than the area handpiece that we use to treat on the face, which is bigger. And when you look at Thermage, there's like an arc of radio frequency that goes into the skin, and when it's a smaller handpiece, it's a tinier arc, and when it's a larger handpiece, it's a deeper arc, so it goes into the deeper structures of the skin. If you use a face, which is like this purple colored handpiece, a face Thermage handpiece on the face, and you try to treat the under eye area, it's gonna not go to the correct depth. So either sometimes medi-spas or less than highly trained individuals will use the face Thermage handpiece on the under eye, and not only is it not safe, it's just not going to work. So the other problem is that you have to put in an intraocular eye shield to protect the globe of the eye. Now, inserting an eye shield is something that you learn how to do in postgraduate, after medical school, during residency, fellowship, advanced laser training. Those are the people who know how to put in eye shields. And if people don't know how to put in an eye shield, they're not going to treat the under eye. So if someone says to you, you're not a candidate, or oh no, you can't do Thermage under the eye, challenge them and say, is it because you personally don't perform that procedure, or do you know how to put in eye shields, or do you guys have specific hand pieces that are indicated for the under eye area? And see what they say, because you'd be surprised, because a lot of providers will just simply say, oh, you're not a candidate, or oh no, you can't do that there, because they simply just don't know how to do it. And the reason why that breaks my heart is because the provider's putting on the patient, they make it feel like it's your fault for asking for something that's just not available, when in fact it's on them, and they maybe don't want to disclose the lack of training that they have. But this goes for lasers too. If people don't do lasers around the eyes, it's probably because they're not trained to do so, or they don't know how to put in the appropriate eye shields. It does take a higher level of skill. So if you want to weed out a provider who you may not want touching your face, those are the kinds of questions to ask. Did you have any laser fellowship training? Are you procedural dermatologist? Do you know how to put in eye shields? Do you use specific settings and laser handpieces addressed for the under eye area? Those are the kind of questions to ask. And for a long time, I felt bad, and I didn't want to, make anybody feel bad for not being able to perform these procedures. But then when I see patients getting hurt or being turned away, thinking that they're not a candidate for a certain procedure, which would really, really benefit them, I feel the need to do my due diligence and put, this out in a YouTube video as educational content for the consumer and for the patient to be your advocate. So on the topic of under eye treatments, we talked about Thermage, which is an energy-based device which increases collagen stores to help lift and tighten and smooth the under eye area. It's good for about 5 years. The half-life of collagen is about 5 years. Now, some people say, well, Dr. Kappel, my provider tells me to do Thermage every year. I disagree. I think that the half-life is about 5 years for Thermage. If you want to do Thermage in a different area, say you want it for like a brow lift or other areas of the face, or, to tighten up the skin on the arms, then I think that would be, a sound treatment. But to do a Thermage once a year, I feel like they're just taking your money, and I don't feel like it's truly indicated. Now, every 5 years, because the half-life of collagen that is generated from Thermage lasts about 5 years, is more appropriate. The caveat is if you're older and you're breaking down collagen at a faster rate than someone like in their 20s, then maybe you'll want to do it every 2 or 3 years, but definitely not once a year, and definitely not less than 1 year, because I feel that it's like going to the gym when you're still sore. After going to the gym and having a good workout, you want your muscles to recover and not be sore before you go to the gym and hit that muscle group again. So I hope that makes sense. Moving on to lasers. Now, there's different lasers you can use to rejuvenate the under eye area. Most of them work by the mechanism of action of increasing collagen stores, just like energy-based devices do. But energy-based devices increase collagen stores by distributing heat in the form of radio frequency, for example, in Thermage, or soft wave, which is microfocus ultrasound, which is not my favorite device, which is why I'm not going to talk about it in this video, because patients are always underwhelmed with the results from soft wave and old therapy, so I'm not even going to discuss that one, even though it does exist. But lasers use photons, which is collimated light in a coherent wavelength, to target water as the chromophore in the skin to stimulate collagen. Now, that was very scientific. I'm going to break it down. Lasers use light. They're light-based devices, not energy-based devices, which use heat. light in the form of photons in a certain wavelength can help stimulate collagen and rejuvenate the under eye area. And there's different gradients and levels of aggressiveness of each laser. You can have ablative and non-ablative. Ablative lasers vaporize the tissue out. They basically take the tissue out and turn it into a gas, like a gaseous form by ablating that tissue. So it's basically taking skin out and removing skin, usually in a fractionated manner. So not the full thickness of the skin, but just little zones, microthermal treatment zones. So it's a faster recovery and less downtime and less painful when it's fractionated. And non-ablative just heats up the skin. So it doesn't actually remove columns of skin from the area treated, but rather just heats up that area to stimulate collagen and to stimulate cellular proliferation, renewal, and elastin fiber synthesis, which helps tighten and helps eliminate fine lines and wrinkles under the eyes. So with lasers, you can have like a Clear and Brilliant, which is non-ablative. You can have a Fraxel Restore, or also known as Fraxel Dual, which is non-ablative, or you can go to like a CO2 or an erbium, which are ablative lasers. Now, ablative lasers are more aggressive, so that means more money, more pain, more downtime. Non-ablative lasers are less money, less pain, less downtime, but the results aren't going to be as good as the more powerful, more aggressive lasers. But everyone kind of can pick what seems right to them. Sometimes people don't have the downtime and they want a one and done, hit it hard, let's get this done. Some people want to be like successive approximations to their goal, to where they're just doing tiny baby treatments, once a month until they get to the results that would be equal to one treatment with a more aggressive laser. So it all just depends on each individual patient's downtime, fear factor, pain threshold, and financial ability to pay for the less expensive lasers that may be, less aggressive, or, you want to go big or go home and just get this done and knock it out with a maybe higher ticket treatment, but, more substantial results. So there's different options when talking about lasers for the under eye area, but whether it's a CO2 or a Fraxel, they all work amazingly well to rejuvenate the under eye area. As a matter of fact, I'm having Stephanie, my amazing laser nurse specialist, tomorrow do a fractionated CO2 under my eyes, and I'll post my results. So many people will ask about the downtime after lasers. So for a non-ablative, very light laser like Clear and Brilliant, there's no downtime at all. You could literally go out to lunch with your friends after treatment in the in-office procedure, and nobody will even know. And a Fraxel or Fraxel Restore, there's usually about 4 to 6 days of some swelling and erythema or redness. You can easily conceal it with either like the Color Science 3-in-1 Total Eye or just concealer or tinted sunscreen. It's actually not bad at all. Now the CO2 is a little bit more aggressive. The length of the downtime is still the same as a Fraxel, but it's more of it. So it's about 4 to 6 days, about 1 week of redness and swelling, but the redness and swelling is more than it is with the Fraxel Restore. So each laser, as you bump it up, is more and more. And then an erbium, which was like the big gun in our office, there's about 2 weeks of downtime, but that's like the strongest, it's like almost like having a surgery. That laser is very powerful, and you have to definitely be prepared for that downtime. But we'll post those results on Instagram if you follow me there soon enough, because we just received that laser last December, just about a month ago, and we're just getting around to using it. But it is a very powerful laser. It literally can almost replace surgery, I could say with confidence. But to put things in perspective, people will always say, well, how many Clear and Brilliants will I need to equal a result of like a Fraxel Restore? It's usually about 4. 4 treatments of Clear and Brilliant will equal 1 Fraxel, and about 3 Fraxel treatments will equal the results of a CO2. Now, because the CO2 is fractionated, the one we use in our office, that just means it treats a fraction of the skin. Remember those little microthermal zones that we talked about, and that allows for rapid healing time, less downtime, and less pain. And the results of a CO2 fractionated laser is pretty equivocal to a full thickness CO2 laser, which is a little bit more old school, because when you're doing a fractionated treatment, that's what Fraxel or fractionated laser just means. You're not treating 100% of the surface area. You're treating maybe 50% of it, or 40% of it, or 60% of it. You can titrate the settings, and you also can determine the number of passes. There's lots that you can do with the laser with respect to the settings to turn it up or turn it down, depending on the endpoints of the skin, which is how doctors know how the skin's taking to the laser and how the skin's responding. And it's truly the art of medicine. A lot of doctors will DM me and say, hey, Dr. Kappel, what are your settings? And can you give me your settings? It's just an art form, and it's not something that's the same for every patient. It's based on the patient's, skin thickness, other products they've been using, other procedures they've had, the hydration status of the skin, and so many other multiple factors that you basically just go by what we call endpoints in laser medicine and the number of passes that you need to do to achieve your endpoint goal. And that may change with every different patient-to-patient basis. But for the most part, fractionated lasers have equivocal results to the fully ablative, more old school lasers, but are a lot safer, I feel are a lot less downtime and a lot less painful. So that's why I love the fractionated CO2 for under eyes, and is the treatment that I use on myself as well to keep my under eye area smooth and firm and tight. Now I know somebody's gonna ask, what about microneedling? So for those of you who know me and follow me, I'm not the hugest microneedling fan, only because I see patients being referred to my office from multiple complications from microneedling: hyperpigmentation, infection, thinning of the skin, fat atrophy. There's so many, and I feel like there's so many more elegant devices that are available instead of microneedling. I always say microneedling is like a cheap knockoff of a laser, because lasers poke thousands of tiny holes using very elegant technology. Someone thought, oh, why don't we just punch a bunch of holes with a machine into the skin and get the same result? But there's not the coagulative dissipation of heat and the other signal transition cascades that are kicked off by microneedling that you get with a laser. So I'm not the hugest microneedling fan, especially for the under eye area, because I've seen countless patients come in with like fat atrophy and worsening of their under eye areas from microneedling. Now, I'm sure there's a lot of you out there who've had great results from microneedling. Usually those patients are younger, and usually those before and afters are, within days after treatment, and a lot of that swelling or increased volume or under eye correction and smoothness is from intermittent swelling that just will dissipate in a couple weeks and you'll be right back to your baseline. But that's not to say microneedling doesn't work for some. I'm sure it works for some, but it doesn't work for a lot of people. And if you can do any treatment to avoid complications or worsening the effects of the under eye area, I say go with a more elegant technology that's targeted and more reproducible and safer to treat that area with better results. And I know a lot of people are going to ask about EllaCore. So for those of you who don't know, EllaCore is a revolutionary, fairly new microcoring technology, which is kind of like microneedling, but instead of poking holes in the skin, you're basically taking thousands of little punch biopsies or excisions of skin out to tighten the area of the skin. So usually EllaCore is used for lower face laxity, fine lines and wrinkles along the jowl area. We use it off-label for the neck. We use it off-label for the arms, the legs, and the abdomen where you want some skin tightening, but it is not FDA approved, and I don't feel it's safe to use for the under eye area just because that skin is so thin and delicate. They have not come up with the technology to date, as far as I'm concerned, with a handpiece that is specifically engineered to treat the under eye area. So although I love EllaCore to tighten lower face laxity, neck laxity, abdominal laxity, especially after having babies, I don't use EllaCore for the under eye today, but maybe by the time this video is posted in the future, there may be some specific under eye handpiece that's engineered for the EllaCore to treat in the future. But as of today, I don't recommend an EllaCore for under the eyes. Okay, so let's talk about injectables for under eye. Can you use neuromodulators for the jelly roll or under eye area? Yes, you can, but you have to do it diligently, very meticulously, and appropriate for the patient's individual anatomy. Because if too much Botox is given in that area, you can have like an ectropion where your eyelid margin doesn't touch the globe of the eye, or you can have an ectropion, or you can have a change in the shape of your eyes. So be sure that you're going to an astute provider. If you're a patient of mine and I do your under eye Botox, then you know that this is true. If you're not a candidate for under eye Botox, I usually will not treat the patient, or will say they're not a candidate. So certain patients are set up for under eye Botox or any neuromodulator. It could be Jeuveau, Dysport, Daxxify, but you have to be very meticulous and careful with where you place it to help smooth the under eye area but not change the shape of the eye. And if you're not a candidate for it based on your anatomy or the way that your muscles are pulling, then you just simply don't do it. But for the most part, neuromodulator can go a long way for smoothing the under eye area. Another trick is to do the nasalis, the bunny lines right here, because although you can't inject Botox right here, it has to do with tearing in the lacrimal gland function, but you can do a little bit of Botox in the nasalis muscle, which will help smooth. It's almost like cheating and trying to get an area that's like a no-fly zone for Botox by treating a yes-fly zone for Botox. Moving on in injectable. So we talked about neuromodulators. Let's talk about under eye filler and filler alternatives like PRP, PRF, and EasyGel. So if you haven't referred to my YouTube video talking about EasyGel and the mechanism in which it works and who it's a great treatment option for, I recommend you watching that video dedicated just to EasyGel. But EasyGel, PRP, and PRF are alternatives to tear trough or under eye filler. And the reason why is because we're coming out of an epidemic of these overfilled faces with these horrible tear trough filler, procedures that are making people's eyes look small and their eye shape look weird and just looking like cat-like faces, pillow faces. And the reason why this has happened, you guys, is don't hate the filler, hate the injector, because usually if a filler is not injected properly or the incorrect product is chosen for the patient, then you have these less than desirable outcomes. Also, it's up to the provider to not only know how to inject filler in the tear trough area appropriately, but also patient candidate selection. So I sat on the round table when Vobella, which is the only FDA approved filler on the market today, was approved for the indication for tear trough filler. So I was in a room in a forum with 20 of the world's leading injectors in the tear trough area and was very honored to be a part of that group. But part of it was just talking about patient candidate selection. And if a provider treats the wrong patient candidate with the filler in the tear trough area, you're gonna have a less than desirable outcome. So it's not only on the injector to inject the filler in the right place, use the right product, but also patient candidate selection. If you've been a patient of mine and I've said, no, you're not a tear trough candidate for filler, then you'll know that this is a true art of medicine practice that really can help minimize complications. So these complications and outcomes that you see online are usually done by our providers that aren't really highly trained and didn't select out for a good patient candidate for the filler in the first place. So I don't think that tear trough filler is something for you guys to be afraid of. I inject people all day, every day in my office with tear trough filler. I usually use Vobella because that's my favorite filler for that area of the face. But also for people who don't want to use filler in the tear trough area, I'm a huge fan of EasyGel. If you've been following me, it took me a while to incorporate EasyGel into my practice because I wanted to treat my own patients with my own hands and see my own results before I, bought the equipment and started using that and providing that as a service in my office to my patients who are like my babies, who I, protect and want only the best for. So EasyGel is a blood product that gets taken when you go in for a blood draw into the office. We spin it down and we heat and cool the blood products in such a way that it makes almost like a gelatinous-like filler product. But the product doesn't have many of the side effects that you can see when filler is not done correctly in the tear trough area. For example, it's very evenly distributed. If it gets injected into a vessel, which God forbid, knock on wood, hopefully nobody's doing that. But if it does get injected or you have an arterial occlusion, it's not as deleterious as if you have a filler, hyaluronic acid filler occlusion or complication in the under eye area. So for many reasons, PRP, PRF, and EasyGel has gained a lot of popularity because it's a safe alternative to filler. Now, it doesn't last as long as filler. It lasts for about a year if you do 3 treatments spaced about 1 month apart. Now, filler can last 2 to 3 years or even more, but also it can break down the composition and can migrate over time as well. So that's another benefit of the PRP or PRF or EasyGel. Now, traditional PRP and PRF don't last very long, maybe a couple weeks or maybe even a month if you're lucky. But the EasyGel, and if you watch this video that I did on EasyGel, I explain how it lasts a little bit longer. It takes the albumin and the proteins in the blood and it helps reconfigure them and restructure them so that it lasts longer in a scaffold type of mechanism under the eye. So think about having like a jar of paper clips. They're all sliding on each other. They're not getting tangled up because of the configuration that they're in. Imagine dumping out all those paper clips, unwinding them and putting them back into a jar and shaking it up. They're going to be kind of cross-linked and attached to one another in a different way, and they're not going to slide on one another anymore. They're going to be in a structural scaffold that allows that product to maintain its efficacy for a longer period of time. So if tear trough filler isn't right for you, I think PRP, PRF, and EasyGel are great alternatives, and of those last 3 that I mentioned, EasyGel is my favorite because it lasts a little bit longer. The caveat is that you have to go in and have a blood draw, and it usually requires about 3 treatments spaced 1 month apart, and results last more like 1 year as opposed to 2 to 3 years that you get with dermal filler. So let's talk about threads for under eye, because I've had a lot of people ask me about threads as well. So I perform PDO threads in my office. Usually it's for lower face lifting or neck tightening, or to kind of get the submental area here tightened up. But for the under eye, you can use something called smooth threads that are collagen boosting injected threads that go around the eye. It's not my favorite. I've been very underwhelmed with the results, and I feel like many of my colleagues have too. And most of the data that I use to talk about on these YouTube educational videos is just information that's hot off the press. So what we're talking about at academic meetings, and I have to recertify my boards every quarter now that I'm 10 years out from graduation, which shows you how old I am. But every quarter they keep the dermatologists up to date with new information, and I take that information directly to you guys on this YouTube channel. And also I take the information directly into my product skincare line, MD Air. If there's new pathways or discoveries that are made in the skin or active ingredients that are discovered, I let my personal chemist know who engineers these products for me. So on that note, I remember at a recent academic meeting, they were talking about smooth threads for under eyes, and the caveat is that you can have a lot of lumps and bumps, and yes, it may stimulate collagen, but there's better, more elegant ways to do it, like using a laser or an energy-based device. So it was a little bit more frowned upon using smooth threads in the under eye area in a recent aesthetic meeting. So I wanted to include it in this video to be comprehensive, but it wouldn't be my recommendation. Also peels. They were talking about phenol peels and multiple peels for the under eye area. Now I don't perform peels on the under eye area in my office, because usually lasers and devices like Thermage are my go-to, but I know that some of my oculoplastics colleagues were presenting their before and afters using phenol peels, which is a very deep, aggressive peel with great results. So I don't perform that procedure, but if you have an oculoplastic surgeon who is in your vicinity, who is comfortable with peels in that area, that can do a lot as well. You have to be careful about the peel going into the eye, because it could cause a corneal abrasion, corneal ulceration, and have a lot of intraocular side effects. So only trust an expert who's in oculoplastics, I would say, if you're going to go that route. But there's other ways to smooth the under eye area without that risk. So I probably wouldn't recommend a peel, but again, wanted to include that in this video for being all inclusive of everything, all the treatment options that are available. I know a lot of people are going to ask about exosomes and growth factors and different post-procedural serums that you can put on the under eye area. Now, I've had many reps come into my office saying, use this product after laser or after other offices who use microneedling, put this on the patient and it's going to boost results, it's going to boost collagen stimulation. And I've been very underwhelmed. There's amazing marketing out there, but a lot of the post laser and post treatment serums haven't been very impressive. I really do love the Elastin Nectar, and I love my MD Air line, the NMF Intense, but you want to have a serum that is decreasing the duration of the downtime. So I'm a Mohs micrographic skin cancer surgeon by training, and in part of our fellowship, any patient who was coming in for skin cancer surgery, we would have to stop any exposure to stem cells, growth factors, exosomes, and so forth. So for me to put that on my patient when I've been trained that it can perpetuate, skin tags, growth, cosmetically frustrating lumps and bumps and potential skin cancer, I'm not a big fan of exosomes and growth factors unless they're your own. So if you're taking EasyGel and you're taking your own blood products and spinning it down and putting it into the tear trough area to help smooth fine lines and wrinkles and add volume and eliminate dark circles, that's one thing. But taking an exogenous source of growth factors, exosomes, and stem cells and putting them on your skin, I would be concerned with increasing skin tags or DPNs or sebaceous hyperplasia or other neoplastic growths that can possibly happen when applying that serum on the skin. And again, this is part of my procedural Mohs fellowship training and the way my attendings would instruct the fellows to kind of like triage their patients and making sure that they weren't on any tumor propagating, potentially aggravating active ingredients. So that's why I'm not usually a proponent of putting on exosomes, but I know a lot of people are. But that's just me personally why I don't. And again, we're all products of our training and our experiences. So I may differ than even one of my good friends who's a colleague of mine, on YouTube or on social media, saying something otherwise. But again, just remember, all doctors are a product of their training and their experiences. And because exosomes weren't really favored upon in my fellowship training as a Mohs surgeon, I'm not a big fan of giving it to my patients immediately post-procedure. I know a lot of other people are going to ask about LED and red light for the treatment of the under eye area. I feel that the data for these LED and at-home devices is all over the place. I did a YouTube video kind of doing a review of at-home masks and LED devices. Just be careful. I think it may be possible to stimulate collagen under the eyes, but they can also increase hyperpigmentation, melasma, brown spots, sunspots. So just be wary of that, because it is heat that's being distributed over the skin, which can increase the melanocytes, which are the pigment producing cells in the skin to make more melanin, which can give you blotchy hyperpigmentation or melasma, chloasma, solar lentiginous brown spots, and all the things. So if you use a LED at home mask and you like it, that's great, but just be mindful, because sometimes it can increase hyperpigmentation, and the collagen stimulation ability of these LED masks have not been properly studied in randomized controlled trials that are statistically significantly sound and in peer-reviewed journal articles for me to have a comment on it. Okay, last but not least, surgery. Are you a candidate for under eyelid surgery? And that all is just very patient dependent, and beauty is in the eye of the beholder. So I always tell my patients, it's really important to manage expectations. If there's so much laxity, or your tear trough is so deep, or your fat pad herniation is so severe that no amount of EasyGel and tightening devices and lasers are going to make you happy and smooth out that eyelid cheek junction, then we can refer to surgery. But surgery may not be for everyone, and surgery does come with its risk of complications. And I always tell my patients, if you're going to have a lower eyelid blepharoplasty or lower eyelid surgery, try to have it done by an oculoplastic surgeon, because those guys are more in tune with ophthalmology and the eye and surgical aesthetic procedures around the eye. And if you need recommendations, I can give you guys a few, but oculoplastic surgeons are the way to go if you're going to have a lower eyelid blepharoplasty. Now, I perform upper eyelid blepharoplasty in my office, so it's an in-office procedure. We just use local anesthetic. Patients do very well. They have about a week of downtime, but that's more for tightening up the upper eyelids. I don't perform lower eyelid blepharoplasty because I'm a dermatologic surgeon. I'm not an oculoplastic surgeon or plastic surgeon. So when you're removing skin off the upper eyelid, it's one thing, and that was part of my training. But lower eyelid blepharoplasty, it's usually twofold. They usually take the fat pad and they free it up from the underlying structures, and they stretch it out and tack it down. So there's a smooth transition between the eyelid and the cheek. And the reason why that's important is because some of the old school surgeons would just remove that fat and take it out. And then patients are walking around looking sallow or like really hollow or almost cadaveric with their sunken eyes. You don't want to remove that fat. You want to go to an oculoplastic surgeon who is going to transposition that fat to a lower area on the face and kind of tack it down so that that junction is smooth. Now there's a second part to the surgery, and that's a skin pinch, where they take the excess skin and they remove it, and there's usually an incision that's made right below the eye. It heals very well. You can't even tell that it was done when you go to a highly trained oculoplastic surgeon, and that will help with the skin laxity under the eye. Now you have to have enough skin laxity to be deemed a candidate for a skin pinch, and usually they determine that by if you can pinch the skin under the eye, let it go, and it stays, like kind of stays in that shape, then you're usually a skin pinch candidate. But some people will have lower eyelid surgery and just have the fat transposition, or they'll have a skin pinch, or they'll have both. So it just depends on your anatomy and the changes in your under eye area that you're trying to correct. Now, oculoplastic surgeons can also do fat transfer, but I actually just recently learned this just last week. I had a patient come in and she had very thin skin and she had a lot of fat pad herniation, and she came in to see me for filler. So I told her that she wasn't a filler candidate, and I actually recommended, in her case she was so severe and her anatomy was set up to be a more surgical candidate. I referred her to one of my oculoplastics colleagues for a fat transfer, and she actually told me that he said that they don't usually do fat transfer, like taking fat from an area like in the abdomen or inner thigh and emulsifying it and injecting it into the under eye area. What they usually do is just transposition the existing fat pad. So I learned something new. So I guess oculoplastics don't usually do fat transfer just for under the eye. Now I assume if you're going in for a deep plane facelift and brow lift and all the things, they will maybe take fat and kind of fat transfer everything everywhere. But for the most part, I learned from my patient last week that usually if there's a fat transfer isolated just to the under eye area, instead of taking fat from an exogenous source and putting it back into the eye, they just take your under eye fat pad and reposition it. So that was a learning experience for me as well. But I don't perform lower eyelid blepharoplasty, so that's out of my area of expertise. But I hope this helps with surgical or non-surgical treatments for the under eye. Just remember, there's 3 main changes that happen under the eye as we gain wisdom and have birthdays. One, you have a loss of collagen and elastin fibers, which are the extracellular matrix proteins. And when you lose those fibers because you stop producing them as much as you used to, or you're having breakdown at an accelerated rate as we get older, as our estrogen gets depleted and so forth, there are things that we can do to overcome that, mainly lasers and tightening devices. The second thing that happens under the eyes is the skin can thin and show the underlying vascular through the skin, which gives us dark circles under the eyes. This brings me to a treatment that I forgot to mention in this video, VBeam. VBeam is a vascular laser, and usually 3 treatments spaced 1 month apart will help lighten the under eye area if you have dark circles under your eye by helping treat that underlying vasculature and brightening up the under eye, so you don't have to use concealer or cover that up. It's a great treatment. I've done it on myself several times. I used to have dark circles under my eyes, and VBeam usually takes it away. So you can have collagen loss, fine lines or wrinkles, you can have dark circles under the eyes, and third, the thing that can happen is you have, hollowing or volume loss. And to restore volume loss, it's usually by a dermal filler or something like EasyGel, or there's other treatments like, under eye blepharoplasty or fat repositioning that can address those issues too. But usually it's fine lines and wrinkles, darkness, and hollowness under the eyes. And those are the treatments that are best at targeting those changes under the eyes. So it may be 1, 2, or all 3 that you have under your eyes going on, and determining what treatment may be best for you or a combination of treatments will be up to your provider. So I hope this empowers you guys. I hope you learned a lot from this video, because under eyes can be very daunting, and there's a lot of crap out there that doesn't work with really elegant, sophisticated marketing, but has no substance and results. So just keep that in mind, and remember, only trust your under eyes to someone who is highly trained and well respected in the field of aesthetics and plastic surgery and dermatology, because it's a very high risk area, and it's the first to show our age, and usually the area that needs the most TLC. Also, I forgot to mention, using an eye serum every day, and of course sunscreen in that area, is really important, because you need active ingredients specifically engineered for that under eye area. Things that vasoconstrict, which help decrease the blood vessel ectasia, and just basically kind of constrict those blood vessels for a very brightening effect. Active ingredients that are stimulating collagen and elastin synthesis, and that are hydrating and reinforcing the skin barrier. So my ECM eye serum by MDR is like my baby. It was my first product that we engineered, and I keep up to date on the active ingredients and vehicle delivery systems that are put into those products by maintaining my board certifications and staying on top of the new information and new discoveries that are made in the field of dermatology by lecturing at meetings, talking to colleagues, and getting articles and randomized controlled trials hot off the press. And all that information I put into my products, and the MDR ECM eye serum has active ingredients that will help brighten, tighten, and rejuvenate the under eye area. Next level results. All right, you guys, I hope you guys enjoyed this video. Thanks. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.